Hello everyone. Today, we're delving into the world of a contraceptive device known as Paragard, which is also referred to by its generic name, copper intrauterine device, IUD. As with all our discussions, this is meant for educational purposes only. If you have questions or concerns about contraception, please consult a healthcare professional. Description: Paragard, or the copper intrauterine device, IUD, is a highly effective form of long-acting reversible contraception. Unlike hormonal IUDs, Paragard does not contain hormones. Instead, it is a small, T-shaped device made of plastic and wrapped in copper wire. It is inserted into the uterus by a healthcare provider and provides protection against pregnancy for up to 10 years. Paragard works by releasing copper ions into the uterus, which create an environment that is toxic to sperm, preventing fertilization. It may also interfere with the implantation of a fertilized egg. This contraceptive option is suitable for women who prefer a hormone-free birth control method. Warnings: before considering Paragard, it's important to be aware of certain precautions and contraindications. This contraceptive device is not suitable for individuals who are allergic to copper or have a history of pelvic inflammatory disease, PID, uterine abnormalities, or certain cancers. Additionally, it is not recommended for women with untreated or active genital or pelvic infections. Always discuss your medical history and any potential contraindications with your healthcare provider. Before getting a Paragard IUD, it is crucial to have a thorough discussion with your healthcare provider about your reproductive health goals and any concerns you may have. Insertion: the insertion of Paragard should always be performed by a trained healthcare provider. The process typically involves a pelvic examination to assess the position of the uterus and ensure there are no active infections. Local anesthesia may be used to minimize discomfort during the procedure. The IUD is then inserted through the cervix and placed into the uterus. After insertion, a thin string attached to the device will hang down into the vagina, allowing for easy removal when desired. Side effects: as with any form of contraception, Paragard may have side effects. Some individuals may experience increased menstrual bleeding or cramping during the first few months after insertion. These side effects often subside over time, but it's important to discuss any concerns with your healthcare provider. In rare cases, the IUD may be expelled from the uterus or perforate the uterine wall, which requires prompt medical attention. It's also essential to note that while Paragard is highly effective at preventing pregnancy, it does not protect against sexually transmitted infections, STIs. If you have multiple sexual partners or are at risk for STIs, additional protective measures such as condoms should be used. Removal: Paragard can be removed at any time by a healthcare provider. If you decide to discontinue its use or if you wish to become pregnant, schedule a removal appointment with your healthcare provider. After removal, your fertility should return to its normal state, allowing you to conceive if desired. Closing: that concludes our overview of Paragard, the copper intrauterine device, IUD. Remember, this information is intended to provide education and should not replace personalized medical advice. If you're considering Paragard or have questions about contraception, consult with a healthcare provider to make the best decision for your reproductive health. Thank you for tuning in.